How war causes health disorders. Introduction. War has long been a defining factor in human history, shaping nations and civilizations. However, the devastating impact of war extends far beyond battlefields and military strategies. One of the most significant and long-lasting effects of war is its impact on human health. From physical injuries and infectious diseases to severe mental health disorders, war leaves a lasting imprint on individuals and societies. The destruction of healthcare systems, food shortages, and forced displacement only worsen the crisis. Understanding these health effects is crucial in addressing the long-term consequences of war and working towards a more peaceful world. Now we will describe this video some health disorders. Subscribe my YouTube channel and like comments videos. Physical health disorders. One of the most immediate effects of war is physical injury. Soldiers and civilians alike suffer from gunshot wounds, burns, fractures, and amputations caused by explosives, airstrikes, and landmines. Many of these injuries lead to permanent disabilities, affecting mobility and quality of life. The lack of adequate medical care in conflict zones often results in preventable deaths or long-term suffering. War also creates an environment where infectious diseases thrive. Overcrowded refugee camps, destroyed sanitation systems, and limited access to clean water contribute to outbreaks of diseases such as cholera, tuberculosis, and HIV/AIDS. The spread of respiratory illnesses like COVID-19 is also exacerbated by poor hygiene and lack of medical facilities. These diseases take a massive toll on already vulnerable populations, leading to high mortality rates. Food shortages and malnutrition are common in war-torn regions. The destruction of agricultural land, disrupted food supply chains, and economic collapse lead to famine and severe malnutrition, particularly among children. Malnutrition weakens the immune system, making people more susceptible to diseases and developmental disorders. Many children who survive war suffer from stunted growth, cognitive impairments, and weakened resistance to infections due to prolonged lack of proper nutrition. The use of nuclear weapons, chemical warfare, and toxic agents has long-term effects on human health. Survivors of nuclear bombings have suffered from radiation poisoning, leading to cancer and genetic mutations in future generations. Exposure to toxic chemicals like Agent Orange and depleted uranium continues to cause chronic illnesses among war veterans and civilians, affecting not only the current population but also future generations. Mental health disorders. Beyond physical wounds, war leaves deep psychological scars. One of the most common mental health disorders resulting from war is post-traumatic stress disorder, PTSD. Both soldiers and civilians experience extreme psychological distress from witnessing violence, death, and destruction. Symptoms include flashbacks, nightmares, emotional numbness, and severe anxiety. PTSD can last a lifetime, affecting relationships, employment, and overall well-being. Depression and anxiety are widespread in war-affected populations. Living in constant fear and uncertainty takes a heavy toll on mental health. Survivors of war often struggle with grief, despair, and a loss of purpose after losing loved ones, homes, and livelihoods. Many are unable to access mental health support, which worsens their condition. In some cases, the overwhelming burden of trauma leads to suicidal thoughts or tendencies. Substance abuse is another serious consequence of war-related trauma. Many war survivors turn to alcohol or drugs as a coping mechanism. Soldiers returning from war often struggle with addiction, leading to further health complications. The breakdown of social and economic structures due to war also fuels the illegal drug trade, worsening public health crises. Impact on women and children. Women and children are among the most vulnerable in times of war. The destruction of healthcare facilities leaves pregnant women without proper medical care, increasing maternal and infant mortality rates. Malnutrition during pregnancy leads to complications such as low birth weight and developmental disorders in infants, affecting their long-term health and survival. Sexual violence is often used as a weapon of war, leading to severe psychological and physical trauma. Survivors of sexual violence experience PTSD, depression, and social stigmatization. Many also contract sexually transmitted infections due to lack of medical treatment. The long-lasting effects of sexual violence extend beyond individuals, affecting entire communities and future generations. Children suffer immensely during war, especially those recruited as child soldiers. Forced into combat at a young age, they experience extreme violence and are often subjected to brutal training methods. Exposure to such traumatic experiences leads to long-term psychological damage, making reintegration into society difficult. Many child soldiers suffer from PTSD, aggression, and an inability to form normal social relationships. Breakdown of public health systems. Wars destroy hospitals, clinics, and medical supply chains, making healthcare inaccessible to millions. Doctors and healthcare workers are often killed or forced to flee, leaving war-affected populations without professional medical assistance. The collapse of healthcare systems exacerbates disease outbreaks and prevents timely treatment of injuries. Water and sanitation systems are often targeted in war, leading to a lack of clean drinking water. Contaminated water sources become breeding grounds for deadly diseases like cholera, dysentery, and typhoid fever. The inability to maintain basic hygiene in war zones increases the spread of infections, further worsening public health crises. Refugee camps, where millions of displaced people seek shelter, are overcrowded and unsanitary. These conditions contribute to malnutrition, disease outbreaks, and mental health disorders. The psychological distress of losing one's home and living in uncertain conditions adds to the suffering of war survivors. Many refugees experience severe trauma, isolation, and hopelessness, affecting their ability to rebuild their lives. Long-term consequences of war on health. The effects of war do not end when the fighting stops. Intergenerational trauma is a major issue, as children born to war survivors often inherit psychological scars. Families and communities pass down the trauma of war, leading to cycles of PTSD, depression, and social instability. Countries recovering from war struggle to rebuild their healthcare infrastructure. The cost of treating war-related injuries and mental health disorders places a huge financial burden on already struggling economies. Resources that could be used for education, development, and poverty reduction are instead directed toward managing the health crisis caused by war. This slows down overall progress and hinders the country's ability to recover fully. War also poses a global health security threat. The displacement of large populations increases the risk of infectious disease outbreaks spreading beyond war zones. The movement of refugees and combatants contributes to the global spread of diseases, requiring international intervention and medical aid. Governments and health organizations must work together to address these risks and prevent further humanitarian disasters. Conclusion. War leaves a devastating impact on human health, causing both immediate and long-term health disorders. Physical injuries, infectious diseases, mental health conditions, and the collapse of healthcare systems are just some of the many consequences. Women and children bear the brunt of these effects, suffering from malnutrition, sexual violence, and lack of medical care. Additionally, the burden on global health security and economies continues long after the war ends. To prevent such devastating health consequences, efforts must be made to resolve conflicts through diplomacy, strengthen healthcare systems in war-prone regions, and provide support for war survivors. The global community must recognize the far-reaching health impacts of war and work toward building a world where peace and security take priority over violence and destruction. By understanding the severe health implications of war, societies can work towards a healthier and more stable future for all.